Hey everybody, it's Dr. Eric Balcouch. We're back for another edition of the Thyroid Answers podcast. I almost forgot what I was doing. I thought I'd do Thyroid Thursdays. I almost forgot. But this is the Thyroid Answers podcast, and I am going solo today with a guest. No Kelly, no Erica. And so it's just me. I think I can handle myself. Although I do have maybe somebody that you might consider a little spunky if you follow her a little bit, or maybe a little bit of a disruptor, possibly. People say that about me as well. But we're going to have a conversation and discussion, and I'm sure you're going to enjoy this topic because it's probably going to be a little spirited at times. But please welcome Danielle Kepics. She is a physician assistant. And welcome to the Thyroid Answers podcast. How are you?
I'm good. Thanks for having me. I was super stoked that you asked me to come on because I've learned so much from your stuff. So I was like, of course I'll come on and chat.
Well, I appreciate that. And to be completely honest, I could be completely wrong in everything I say. I don't know, right? So, I think I've got some of the right concepts, but this in medicine, when we think we know it, we really are going to find out probably in a year or two that we really didn't know what we thought we knew, right? I think I posted today that we're like in the infinitesimal learning stage of what cellular physiology really does. And we work on the best premise and the best concepts and ideas we have, but it is not unusual to find out a year, 2 years, 10 years down the line that what we thought was the case and what was fact, really wasn't the way things work.
Yeah, I think that one of the most important things in medicine as medical providers, as researchers, as any type of role in healthcare is you have to be open to being wrong. Mm-hmm. When we seek things out, we have to be willing to accept that this might be proven wrong in a little bit. And I think that's just part of medicine evolving too. Like things that we were doing in the 1950s, things that we were doing in the 1930s, like that's not how we do things anymore because we've learned more. Like what Maya Angelou, like you can apply her statement to like, when you know better, do better. Same thing in medicine.
Yeah. And the issue, whether it's allopathic medicine or functional medicine, the person who scares me the most is the person who's so confident that they are right. That's the person who scares me the most. When somebody calls me and says, I'm coming to you because you're the expert, I always say, listen, I'm not an expert. I think I know some stuff and I try to apply those things and explain those things, but I could be wrong. I could be wrong, but I'm trying to work off the best information and data, not listen to a bias, not maintain necessarily my own bias. And as you're saying, the more you research, kind of one of the things we want to do is almost prove our ideas and concepts wrong, right? And I think that helps us if you say, okay, this is what I think, but here, let me see if I can find reasons why what I'm thinking isn't correct. And that kind of gives us either a little bit more confidence about what we're saying, or it helps us understand it, man, I wasn't quite right. This is maybe a different system. And I think as physicians, we have to be humble, super humble.
Oh my gosh.
And not cocky and arrogant, which typically happens quite a bit. But before we get on to this tangent, I think people need to know who Danielle is, right? Yeah. Because they're like, why is he having her on? Why are we listening to her, right? So can you give everybody your backstory? Because you look fantastic, You look great, you're fit, you're in shape, and you're a physician assistant, but we're talking about functional medicine. This is the Thyroid Answers podcast. Like, what's your story? How'd you get here?
Okay. So I graduated from physician assistant school in 2014. I was drawn back to medicine because I was working as, I don't even think you probably know this, but I was a former mental health counselor. So I have my master's degree in counseling psychology as well. So I have always had a healthy respect for the mind-body connection and how important it is to maintain good mental health and how integrative our health really is. I don't think that I had a clear understanding of the lack of respect that allopathic medicine has for that as a whole. I recognize that there are plenty of providers who do have that respect for it. But I graduated, I started getting into medicine, and I started recognizing, this is not 100% the change I wanted to be in the world. I believe really wholeheartedly that we have a lot of power over our health and that we can create change and cultivate any life that we want. And I feel that being healthy in mind, body, and spirit, and how that all interconnects is a very large part of that. So I started dabbling. I don't know, I got down some dark rabbit hole, multiple of them, and started learning about functional medicine and learning about naturopathic medicine and acupuncture. I've seen an acupuncture since I've been 18, which is really strange for someone to say, I think. But I started really learning about that. I'm like, okay, I have limits as to what I can do in allopathic medicine. Like, I can't work under a naturopathic physician. I can't work under an acupuncturist or with an acupuncturist without a doctor running that facility, right? There are limits, fortunately and unfortunately, to my degree. But I was like, you know what? I've never been someone to play the victim mentality and sit in an external locus of control. So I'm going to do what I can and sit in an internal locus of control. And like you said, kind of be a disruptor and offer my patients something different that they haven't seen. And there are a lot of people who still see an allopathic provider who are very, very hungry for that. So.
Yeah. And when I say disruptor, I say that in the nicest way, because
I take it as a compliment.
Yeah. So I think sometimes being like a disruptor in a space isn't necessarily this bad thing, right? It helps people it creates a little bit of controversy that hopefully has people start to ask better questions, right? Like, man, that person's saying that, like, what are they thinking? And then maybe just take a step back and go, what if they're right? Like, what if they're saying is right? And that's all sometimes you need from somebody, is just that pause where their arrogance about how things are breaks down just a little bit. It crumbles a little bit. And now you have the opportunity to get them to maybe take another look. They don't have to agree, but at least be open to the idea and concept that maybe things work a little bit differently than we learned or how we were taught. Do you see it the same way?
Yeah, I do. And I actually have frequently described myself as a toddler that never grew up, because as we know, 2- and 3-year-olds constantly ask why. Mm-hmm. And I've never stopped doing that. And I think a lot of people maybe some people who continue down the allopathic pathway, they don't have that same mechanism in them. It's simply they follow whatever guidelines they've been taught. And even when you have new information coming out, right? Like, a really good example for the world that you live in is, why the hell don't we test a T3? Mm-hmm. Like, in general, I mean, I do, but my colleagues all around the country probably don't. There's not a lot of them. Why aren't we doing that? It's the most active form. But I started asking why. I started asking questions. And so I do think it's almost important to have, like, not even necessarily to be a disruptor, but to have that mindset of, I need to continue to ask why, because I need to continue to learn.
Right. And I think that's the question. I think too many of us, I think, go through life in general or in our profession like we're bowling with the bumpers up. You know what I mean? Like, hey, I'm just going to take this easy way to do it, right? So the bumpers are up, nothing can go wrong. I'm just going to follow the rules, follow this trough, right? And nothing really good becomes of that. It's the people who are pushing the edges, willing to take risks, willing to ask questions, and maybe get slapped around a little bit for asking those questions, that actually make the difference in this world, right? And so we start asking questions, creating some disruption, changing the kind of mindset and paradigm that occurs. And then that's when we start getting more people to feel comfortable asking questions or starting to question the status quo. And that's when we start to see kind of the evolution of things, whether it's different aspects of health, life, behavior. I think that's when we grow the most. So because you're straddling two worlds, like this bridge between these two, how did somebody say it? One of my clients, great guy, medical doctor, but the way he said it was, I didn't even know that there was this parallel universe that existed outside, allopathic medicine, right? I didn't even know I didn't even know what functional medicine was. Like, I think he just heard me on a podcast somewhere and was like, that's different. Maybe I should give that person a call. and has been a fantastic person to work with. But you think about that. Here's a whole bunch of people. This is a guy who's really good at what he does. Didn't know this other thing exists. As you're working in the allopathic space, how many doctors do you come across, like percentage-wise, who don't know there exists a parallel universe, or think that they know that it's there? It's all nuts and crazy, right? All fairy tales and unicorns. And what percent are really understanding that, hey, I get it, I understand it, I think it's important. I don't have the ability to do it in my current role as a allopathic, insurance-driven practitioner.
It's a good question. So I think, first of all, it depends on the generation that you're talking about, because I do think the new generation of doctors who are going through med school right now in allopathic or osteopathic schools, right? DOs, love my DOs still, they don't get enough love. But that generation coming up is very interested in alternative medicine, more natural medicine or functional medicine. I think even the ones who are going the allopathic route really want to integrate that more frequently. I'm not saying that all of them. And I would say for the existing providers, I mean, if they've been in it for a long time, I would say that they're a minority. If you have your doc who's been practicing for 10 or 15 years, to have something come along like naturopathic medicine or alternative therapies such as chiropractic medicine, massage, Reiki, any of that stuff that can be really valuable to a person. They really slough it off, I think, for the majority of them. I'm not saying all of them. I don't live in absolutes as a person at all. Life is lived in the gray space, so I believe that with everything. But I do think that we're starting to see a shift, and I find that very, very enlightening and more hopeful for the future, that we can work more as a team instead of fighting against each other, because that doesn't help patient care. And when you get down to it, like that's really what we are all in this for, is to help people, right? Like, we're helpers, and it does not do anybody any service to sit here and bash each other.
Yeah. And, I see this in the functional medicine space. I see this in healthcare in general. Instead of really addressing the root cause issues, what we have a tendency to do is circle the wagons and shoot in, right? Yeah. That everybody's my competition, right? And instead of really getting to the root issue, which is, hey, we have a healthcare crisis. And what we need to do is there's space in here for everybody: an allopathic physician, a functional medicine practitioner, integrative, whatever those things are, whatever those labels are. There's space here for everybody because of the crisis that we're in. And part of the reason we're in that crisis is because we have a tendency to look at healthcare from one paradigm, right? That I need to drug it or cut it, and that's the solution, versus, hey, how did we get here and how do we address it? And not that that's the consensus of all medical physicians, but the problem is that's how that model is kind of built around, like, what can I give them to manage a symptom or disease? And nothing's medically necessary until it's at a point that it needs to be drugged or cut. Anything else, it's not medically necessary. And that puts people and patients in a really tough situation, because they don't feel well, and they often get told they're nuts, they're crazy, they're lazy. And not maybe because a physician doesn't want to help them, but because of this bowling bumper system of insurance-based care, they're like, I can't give you an hour to go through your health history and try and help you figure it out. I haven't had the training to be able to talk to you about diet, nutrition, and some of these other newer concepts. I don't have time to read alternative type ideas and concepts, because I'm so busy with my every 15-minute practice of seeing a patient and high volume and meeting my goals. So, the issue becomes, we've got some challenges that we need to address, but there can be a role for everybody. Do you see it the same way, that there is a role? And how do you look at the role of, let's say, allopathic physician functional medicine practitioner, and maybe the person that's in between those both worlds, the integrative practitioner? Where do you see space for each of them, or maybe you don't?
Yeah, so I do think, I think people can't see me, but I'm nodding to everything that you said, because I do think that we live in a box, right? It's very in allopathic medicine. And I do think that that box needs to shift. I think that it needs to open its eyes to functional medicine principles and get away from this. I don't see patients every 15 minutes. I don't know how people do that. I have not much longer, but I have longer appointments in my practice, and I'm fortunate that that has been supported by my managers and such. But I do think that a general shift does need to happen in allopathic medicine in order for the larger picture for us to come together and work together, right? So like, I'm not the person sitting over here who's going to tell you that you can cure your cancer with essential oils. I just don't think that's going to happen. I think that there is a place for everything, and that modern medicine is amazing. My boyfriend is actually an appendix cancer survivor. It's a very rare type of cancer. And if it would not be for modern medicine, he probably wouldn't be here. So I don't want people to think that I'm sitting over here just demonizing things, but I do think that we need to be open to a shift. And I do think we work in a broken system. I do think that there's space for everybody. I'm very, very lucky that one of my best friends is an acupuncturist. So I learned so much about Eastern medicine and philosophy and things from her. And, my dream is to see like a functional medicine practitioner, and an acupuncturist, a chiropractor, like all of that in one office. And I think that when and if we can get that to happen, I think that we will see a large shift in healthcare overall. But I also think that there has to be a mindset shift, right? So like, there's just this huge issue with where people are right now. And I see this in my practice, is people just want a pill. Right? They want drugged and cut. Some people don't. I would say there's about 50% of people that end up to me that they're like, I don't want to just take a pill. And I'm like, blessed be the day. I'm so happy when I hear those words come out of a patient's mouth. I'm like, okay, let's talk. But I do think at large, there has to be more of a shift towards health and wellness as opposed to sick care. Right? Like, I don't even call it healthcare. It's sick care at this point. And if we really want to be in the business of keeping people healthy, there needs to be a paradigm shift.
Yeah. And maybe part of the problem starts with what health is. I mean, a big issue is we don't really have a good definition of healthcare. Because if you look up healthcare, it'll say a state of wellness or the absence of illness or disease, or, that's not healthcare. Health is not a black and white thing, right? It's more of a spectrum, right? You either have like optimal, exceedingly, or excellent health, or you have terrible health, but it's more of a continuum. And everybody looks at health and says, well, I think I'm healthy. Okay, well, what's your standard? Well, I can do what I need to do, right? And so if I can do what I need to do, then I'm healthy. Well, okay. Or do you think you're as healthy as the person who's not taking any medications? Well, yeah, maybe, right? So I think that's the issue. So how would you, I'm sure you see the same thing. How do you kind of explain health, or what health is to your clients and your patients?
I love this question. And I think this is such an important point. I say this all the time. Health is not the absence of disease. Health is having the capacity to thrive in anything that you want to. It's not merely scooting by. I call these people strollers. Mm-hmm. If you're merely getting by in life, you're strolling and you're allowing life to happen to you, instead of taking it by the horns and having the capacity and the ability and the functionality to do the things that you want, right? So many people are limited in what they want to do with their lives because of their health status. And that's why I feel so strongly about this. Patients come into me, I can't play with my grandkids. I can't walk. I get too short of breath. I lose control of my bladder. I mean, you name the thing. I'm too large. I don't fit in an airplane seat. I mean, all of these things are issues where, when we were just talking before we started recording, I'm hiking the John Muir Trail in 8 days. And so many of my patients, when they found out I was doing this, they're like, I wish I could do something like that. I'm like, you can. You might not be able to go do it today, but if you start now, you could do it in a year. So just, I don't subscribe to that definition of health as the absence of disease. I think that is the mindset and the definition that is truly harming us as as a country with our health.
Yeah. I mean, I try and get people to understand that, right? Health is like, if you're optimally healthy, you have you have the ability to adapt and thrive in your environment without drugs, right? Without any other things to kind of maintain you. Obviously, besides, water and food and those things are important, but the healthier I am, the more adaptable I am to my environment, and not just my current environment, but other more kind of stressful environments, right? And so, because somebody would say, well, I'm healthy because I'm adaptable in my environment. Well, you don't do anything. You sit in your apartment and you don't go anywhere. So you assume you're healthy. But if I have you climb up the 2 flights of steps, then go in an elevator, and you're out of breath or can't do it, then you aren't adaptable to your environment, right? You've just shrunk
Correct.
your environment down to something that you can work within. And you now say, okay, I am now, I'm healthy because I can do it. Or the person, I had this conversation, I think, with somebody in our space who said, I'm really healthy. I just have a thyroid problem. And I was like, okay, then you're not really healthy if you have a thyroid problem that requires medication on a day-in-day basis. You have a level of health, but you're not optimally healthy. Because to me, if you're optimally healthy, you don't need that extra medication to adapt and thrive in your environment. Am I saying that don't have a level of health? No. I mean, they may need that thyroid medication because something's happened. But if we took 2 people and put them next to each other, the person who doesn't need the medication can go out on the John Muir trial without that medication and thrive and be okay. The person who requires that medication, if that medication gets lost, they're in trouble on the John Muir trail after a period of time, right? So it doesn't feel good to say it. And I don't think it felt good to that person when I said that to them. And the issue is I'm not giving them a hard time. I'm just saying, hey, you're here, but you could probably even be here. I mean, as if you're athletic, right? You think that, okay, I'm pretty good because I can do, 50 push-ups, but the guy next to me can do 60. So maybe I can do more, right? You know what I mean? That's how the 4-minute mile got broken, because somebody was like, well, yes, that's the threshold. But why can't I beat it, right? Being the person who asks, why can't I beat it? Why do I require a blood pressure medication? Does that mean just because my blood pressure is normalized that I'm healthy? If you were healthy, you wouldn't need the blood pressure medication, right? So I think we really do need to change that conversation, not just within the medical field and functional medicine space, but with the patient needs to have that conversation. Like, okay, painting a moldy wall does not fix the real issue. It looks pretty, right? But the mold is still there. The moisture that allows the mold to grow is still there. Sometimes we see the mold, like mold, and say, oh, the mold's the problem. No, it's not. The environment that allowed the mold to grow is probably more the problem, the terrain, right? So how do we bridge that conversation with clients and patients to help them maybe see a different perspective, knowing full well that some of them just want, and I think it's fine. If you want to be the person that just wants I don't want to do it, just give me a drug, a surgery, a medication, that's fine. I think it's fine as long as you accept that and the ramifications that come with it. But how do we get the people that really are almost unaware that these things aren't normal and there are ways to address it and improve their level of health? How do you have that conversation with somebody?
So for me, every single new patient that comes in to see me, I talk about the things that I think are the 5 pillars of health, and they are sleep, stress management, nutrition, exercise, and relationships. Mm-hmm. And I talk to people about the quality of those things in their life. And I explain to them what my definition of having quality sleep means, what healthy stress management looks like, and good mental health, what a healthy balanced nutrition looks like. I don't like the D word. Diets, people go to like all kinds of fad, crazy crap. And I don't like to go there with people. Exercise, like how do you move your body? How often do you move your body? What does that feel like for you? Relationships. What are the quality of your relationships? Do you have a close connected community? Because not having that is the equivalent of smoking 1 pack of cigarettes per day for your health. Like, it is not healthy. So I go through those things with people. And for women, I talk about their menstrual cycle very extensively. I'm sure you know how passionate I am about making sure women understand that their menstrual cycle is a sign of health. And then I'll say, okay, these things to me are markers of how healthy a person is. And you think you're in good health, but you sleep for 4 hours a night. You're eating ramen for every meal a day. You don't exercise. Like, this isn't adding up to me. So we need to have a discussion about this. And, the most accurate thing that a patient ever said to me was that I was firm, direct, yet compassionate. I don't shy away from the difficult conversations because I'm worried about someone giving me a bad Google rating. I don't think that's having good integrity as a practitioner. And I sure as hell don't think it's helping anybody, especially the patient. Now, I'm not saying it's helpful for me to be mean to someone, which I'm not. I'm in this because I have compassion for these people. And I understand that everybody has a story. I also understand that if you remain ignorantly ignorant and you don't know that you're doing something that isn't serving you, you're never going to have the capacity to change that.
Yeah, and I think the concepts are the same. At some point here, I'll have my book finally out. But in the book we talk about fitness factors, like your level of fitness in different aspects, and it's very similar to what you're talking about, emotional fitness, right? Because we could say, hey. Emotional stress. Well, we're all going to have emotional stress, right? All of us, yes. Right? And sometimes emotional stress is good. Sometimes it can be problematic. But what's your level of fitness? Just like physical fitness, right? The more physically fit you are, the more adaptable you are to any environment, the more you can thrive in any environment. The higher my emotional fitness, right? The more adaptable I am into somebody screaming at me or yelling at me or somebody giving me grief. So I talk about the level of fitness, very similar to what you're talking about. So emotional fitness, physical fitness, dietary fitness, right? We talk about respiratory fitness, how well you breathe, your sleep fitness. We talk about habitual fitness, like what are your habits, right? And I have to try and, from my perspective, I think we talked about this in the past, habits versus behaviors, right? Sometimes people think they have healthy habits when really all they have is a periodic healthy behavior and a lot of unhealthy habits. And we talk about metabolic fitness, which is really, it's a little bit harder for somebody who's a layperson. That's really our wheelhouse to say, how do we raise your metabolic fitness? Mm-hmm. But those are all things we got to take a look at. And then we'll talk about genetic fitness, environmental fitness. So I think for most people, when I'm trying to help them, I want them to realize that excessive stress on their physiology is what's breaking them down, right? Yes. And the only way that we're going to improve their health, there's no secret supplement, despite what you hear on Facebook or Instagram or some ad, right? There's no secret medication that's going to do it. You have to be able to reduce your stress load to a point that the danger response goes away. You can go back into what we call homeostatic regulation. And then you can have bouts of significant stress. As long as you allow for recovery, your body gets stronger. It's just like exercise, training for a marathon or anything else. You have to build that level of fitness in each of these categories. And sometimes people focus on one thing. My diet's really good. Yeah, but you don't sleep and you don't breathe well and you live in a stressful and traumatic environment, right? So yeah, that piece is good, but really that old saying, you're only as strong as your weakest link, right? Is part of the issue. So I think that those two things kind of go together, like what you're saying, what I'm saying. I think a lot of us say the same thing, just differently, right? Yep.
And I think that, we've become somehow a society where we feel like we feel that the external environment has to adapt to our internal environment, right? Like things have to change externally for me to be able to thrive. And I'm like, listen, your external environment, you're never going to have control over that. Like, people need to understand that, and things are going to constantly change, and you're going to have constantly evolving stressors. If the past 2 years have not taught you that, you've been living under a rock. I am sorry to tell you that. We need to adapt. Like, if you don't adapt, you don't survive for the most part. Like, I mean, that's just Darwinism.
I think we're seeing that through COVID. We learned that the most, because if you start to look at the statistics, right, the people that died, right, are the people that had chronic illness, right,
Yes.
chronic health issues,
Yes.
and they were put in a situation where their state of diminished health made them very susceptible to
Yes.
a virus that we didn't have tools to address at the time. Right.
Yes.
And everybody's
Yes,
panicked.
100%.
But if you think about the community that was least concerned, it was those people who are already had a higher state of health, higher state of fitness, right, in these categories, who are like, okay, it's a virus. My immune system is trained to deal with these things. There may be some sickness and illness, but the vast majority of those people weren't the people who were getting severely ill and passing away. Some did, but the vast majority, if you
Correct.
look at the numbers, and I think I saw last year's statistics, 400 and I don't know how many thousand cases and stuff, and you saw what the statistics look like. The amount of people who had a higher state of health that died as a result, really small, right?
Yeah, I mean, if someone can physically show me statistics that argue with that point, I'm open to have that conversation. However, most of the data that I'm seeing is congruent with the things that you're saying, and I recognize that those people were meaningful to other people, and that they were their loved ones, and that they lost them, and I feel for that. However, you can't argue that point. People who were sick and weak and had morbidities. I talked to a paramedic who I have as a patient, and he was just bringing people out of their houses, their bodies, or they were already dead, or they were in very bad condition. And I said, can you tell me about the demographic? He's like, overweight, diabetes, hypertension, period, the end. I mean, that he didn't see any very, and yes, age is a risk factor. It's what we would call in medicine a non-modifiable risk factor, right? Like, my 70-year-old aunt can do nothing about the fact that she's 70. It's kind of like coronary artery disease. 7 out of 9 of those are modifiable risk factors, right? So, I think a very productive conversation to come for that is, what can I do internally? What can I do in myself to better prepare myself in the future? We're seeing it again right now. There's variants of this virus. This is what viruses do. They mutate. This is their survival mechanism, right? So my hope is that a lot of people out there saw what happened and decided to take matters into their own hands and say, maybe I need to eat a little healthier. Maybe I need to, get into a little bit of a healthier weight. And I'm not one of those people that is like the end all be all is the BMI. I don't live and die by weight as a marker. But when you're 400 pounds, you're probably not doing things to serve your health. I'm sorry, I can't subscribe to that. Same thing as someone who's 60 pounds is not making choices to serve their health. It's illness both ways. So I hope that what I hope is that we're starting to create a shift and a conversation about what we need to do and our responsibility as individuals to adapt to our external environment.
Yeah, because it's going to be a while till the healthcare industry makes a change, and they may never, because this is a pretty profitable model as it stands right now. There's a lot of money to be made or lost in healthcare if we change the model. So we really do have to take it upon ourselves. And I do think this crisis has taught some people that, hey, I need to be responsible for me. I don't want a government telling me how I need to act or how I need to behave or what I need to do. I need to be responsible for me, because at the end of the day, I'm responsible for me, my family, my loved ones. But ultimately, I got to take care of me first. And otherwise, nothing changes, right? It's going to be, I'm a slave to whatever somebody says. And sometimes I'm almost appalled that the people that are actually driving healthcare are sometimes you see them and they're some of the most unhealthy people. And you go, these are the people that are providing guidance as to what we should be doing as a country from a healthcare perspective. And they're overweight, obese, you go, is that really the best model? But we could beat on this topic, but let's go to something else. Okay.
Okay.
So
Okay.
there are, and we'll get some good stuff, but I
Yeah.
came from allopathic medicine. So I think I'm fair to be able to say, hey, I can see both sides of this. Now, when I shifted from allopathic medicine to chiropractic care and became a chiropractor, I was like angry, I think, to some degree. And some of the things that happened to me from a health perspective, in healthcare issues I had that didn't get addressed well in allopathic medicine, I think that made me angry early on. And I was really anti-allopathic medicine. And, that doesn't serve anybody. And I realize now, maybe because I'm older, maybe a little softer and maybe a little wiser, that, hey, people are doing their job and there's a role for everybody. But I think allopathic medicine, integrative medicine, functional medicine, I think we get some things right. And I think we get some things wrong. So what I want to do is give me the top 3 things from that you see that allopathic, functional, integrative medicine is maybe doing right, and the big things that maybe they're doing wrong. And then we'll talk about maybe solutions.
Okay. I think, one of the things that is great that has come from allopathic medicine is screening and preventative care. So your colon cancer screening, your cervical cancer screenings, breast cancer, prostate cancer, those types of things. I think that allopathic medicine has done a fantastic job to advocate for people to get their preventative care and get their screenings and reduce the number of cancer that we see. I think that allopathic medicine does a deep job of getting their patients to come in on a regular basis and be seen for their annual wellness visits and things like that. Again, like, even if they aren't getting the best care, hopefully that they're getting some care, and we're addressing the things that we can within a limited model, right? Some of the things that I think are lacking, my biggest one is the normal lab values, or the lab values that we live within, and the labs that insurance will cover. I think just insurance, I can say, is a huge umbrella, is something that we are getting wrong under an allopathic model right now. And I understand, like, people just don't have the money. It's expensive. It's hundreds and thousands of dollars, right? So for someone to drop that on labs, it's sometimes not realistic for us to be able to expect that. But I see it all the time. And I think another thing that I see a lot is, when we see lipid panels come back out of range or abnormal, or, nutrition levels, patients get these blanket statements. Probably my biggest pet peeve is work on diet and exercise. Oh, okay. Like, what does that mean? Like, what should I do? Are there certain foods I should be eating, or, certain foods that I should be minimizing? So I think those blanket statements and the lack of malleability with lab levels and what labs can be run are some of the biggest issues, in my opinion. And if your lab values come back normal, well, you're fine. You see that meme rolling around, the person's like got hives all over, they're busted with Band-Aids, and your lab levels look fine. It's like, that's not helpful for that person. You know what I mean?
Right.
So.
Yeah, I think those are good ones. From an allopathic perspective, I think one of the big challenges, and I don't know that it's the doctor's fault per se, right? I think it's the way the training is, it's the way it's insurance driven versus patient driven.
Yes.
I think that's the bigger issue, because I think if given the ability to do more, or have more flexibility to do what they feel is best for their client without the reins of insurance company maybe slapping hands for why they did something or denying something, I think more physicians would probably do more for their patients in the model. But definitely, I think one of those things comes down to is, from an allopathic standpoint, we need to kind of change the model. Who's in charge? Not insurance company. The physician should be in charge. 2, I think one of the biggest things, and it's one of the things I see in functional medicine as well, or integrative medicine, is I think we need to do a better job in allopathic medicine of interpreting labs versus reading labs, right? And so one of those things that we see, and this is across all of the physicians and healthcare providers is we look for an H or L on a lab report and assume that as long as it's within that range, it's good. In functional medicine, we say, as long as it's within my narrower range, it's good. And in allopathic medicine, it's, hey, as long as it's inside the lab reference range, it's good, right? So I think that piece is a problem. And for the person who's listening, what I mean by that is that we need to look at your labs as well as your health history, your signs and symptoms. Like, we have to take all of that in context, because you can have a totally normal lab value and it's appropriate. If you feel fantastic and your lab values are in lab reference range or in the optimal range, then great. It's probably a valid result. But if you have a lab range that's normal and you have a patient who's got all these chronic signs and symptoms, then maybe the value is normal, but it's totally inappropriate for the person sitting in front of me. And we see that in thyroid physiology all the time. Your TSH is normal. No, your TSH is actually on the low end. You're more hyperthyroid than hypothyroid. So it must be that you're eating too much, you're depressed, you're anxious, you have anxiety, whatever. It can't be a thyroid problem. That's where, as physicians, we need to do a better job and be able to say, hey, well, the reason that your TSH is low is because you have inflammatory mechanisms, and that's what's driving your TSH down. And yes, you do have a hypothyroid condition. It's just being masked by your medication, your other signs and symptoms, your inflammation, whatever it is. I think that's where I think we need to do a better job. Would you agree that we probably don't do as good a job in interpretation? More reading gets done?
Oh yeah, 100%. I know, even for myself, I probably have a lot to learn about that. And I'm working on that step by step and just looking at different things, like how different minerals are, are their ratios in line and things like that. I mean, there's, and you kind of touched on this earlier, there's so many things to know. Like, I know that I don't know everything. So I'm always looking for new resources as to, when I look at these labs, are there other things that I need to be looking at with it? Iron is one right now that I'm kind of diving into, and I'm really learning a lot about the importance of copper levels and copper metabolism to relate to iron and things like that. So I think that we are all guilty of that at some point, you know what I mean? And I definitely, at the beginning of my practice, I was a reader and I would say I'm much, much more an interpreter at this point as to looking at signs and symptoms and what lab levels look like. And I also do work within a tighter range in my practice. I want optimal levels. So.
Yeah. And so, you hear, and I'm not giving, there's a lot of people that, especially in functional medicine, I hear people all the time, they're like, get started. And like, how do I get started? Like, hey, you're going to learn to read the values first. And then as you get more skill and you learn more, you're going to be able to start to interpret. And that's a skill that comes with time, with learning, with education, with doing things wrong, with screwing things up, and you're going to learn. But we have to interpret labs with the patient health history and timeline and signs and symptoms as part of the perspective, and what medications, what supplements are they taking? Because all those things can mask. What time of the day did the person actually draw the blood, right? Is this a test is this a lab value that's on a circadian rhythm or not on a circadian rhythm, right? So those things become important when we're looking at labs. And if somebody is just the tech in the gal at the front desk or the guy at the front desk who picks up the lab report, goes, no H's, no L's, everything's good, doc. I mean, that we have to change that, right? Yes. And I think the other thing that we needs to change, but I don't see that it's going to change, is to allow physicians to run more comprehensive tests. When I went through my training as a medical technologist, we were taught that you made your diagnosis and then ran the test to confirm your diagnosis. And I questioned that in school, because I was like, but what if my diagnosis is not accurate? Wouldn't it be better to run more testing to get a broader view of what's going on so that I can make a better decision? Because if I run one or two tests to confirm what I think, maybe I miss what's really going on. When I run a broader panel of tests to get a 30,000-foot view of what's going on, now I get a bigger picture of what's going on. And maybe I come to a different conclusion. It's kind of that, like, what is that? The 5 blind men and the elephant? Like, isn't there a parable, like, where they're all blindfolded and they ask them, what do you feel? And they describe this elephant all in different sections because they're all blind, but they only had this little piece to feel. That may be past your time. But what do you think about that? Do you think that not the elephant, but what do you think about the idea that maybe we should have a little bit more width and breadth of labs sometimes when we're assessing things?
Oh yeah. I mean, I just got done having a conversation with a patient the other day about how I think that at least once a year, within reason, you should be allowed to run whatever tests you want and have that covered. So vitamins, nutrients, full thyroid panels, I mean, Dutch tests, trace hair mineral testing. Like, I think that, you're paying a lot of money for your insurance. And I like, obviously at some point that's not realistic and you need to have a limit, but obviously doing there's some really, really expensive tests out there, like, and you should have some justification for it. But I think that as far as things that keep you healthy, like your vitamins, your nutrients, those kinds of things, I think that should 100% be covered under insurance at least once a year, so that people can understand, hey, like your vitamin C is low, your vitamin E levels low, like whatever the case is, this is how we might be seeing this impacting your health currently, like you're having X, Y, or Z symptom. So yes, I 100% think that. I also think that people can get carried away with it too. So, and I have those patients I had a lady who came from, a naturopath that I think was really just taking her money, and I love naturopaths. I love naturopathic medicine. I think it has a ton to offer. This lady was on a 1.5 pages of supplements. A lot of them that were affiliated with her. And I'm like, listen, this is doing you more harm than good. And she's just running all these tests all the times and just getting to a point where she's so obsessed with health that it's unhealthy, if that makes sense.
Absolutely. I mean, that becomes part of the emotional stress component at some point, right? Is that they're so stressed out about every little marker that they're not doing anything else. And they're hyper-focused, and it actually creates excessive stress. So what do you see, because you have the ability to see the blend, where do you see, because sometimes we get this, especially those of people who are into functional medicine, like, this is the best, that stuff's bad, like, we're so much better. Where do you see the problems in functional medicine? If you had to take a look at functional medicine, like, what would be your big 3 with where you see the challenges in functional medicine?
I think the biggest one that I can think of off the top of my head is the patient that I just described. I see a lot of people and I lived in that world for a while. For people who know my story, who might be listening, like, I got very obsessed with counting macros and my body composition. And I got so obsessed with being healthy that I was super unhealthy, right? And so that person who's really attracted to that type of care, I think, is not the person who is generally going to be somebody who is more healthy at baseline, in my opinion, and from the things that I've seen. So I worry about creating a little bit too much obsessiveness with health and patients wanting to run tests too frequently or wanting to be on too many supplements, because then those supplements, I mean, your liver still has to process all of that, my goodness. So that is one of the problems that I can see, maybe just a teeny bit of functional medicine cultivating, if it's done the wrong way, right? Not the functional medicine practitioner who's out there doing it right. I'm trying to think about like other problems that I see can think of with functional medicine, and I don't know that I can think of 2 more. Are there ones that you can see?
Yeah, well, I think you're on the right track. Like, I think one of those things is that we bash allopathic medicine for prescribing medications for every sign and symptom, and yet then some of those same people, whether they come from allopathic medicine to functional medicine, are prescribing a supplement for every given sign and symptom, right? And so, yeah, you have the patient come in. I think the record for me is 180 capsules per day with what a patient was taking per day, and they wanted some more to fix what was going on. And, my common saying for people when they come in is, listen, you're coming to see me because you have a chronic health condition. If you need as many supplements as you're taking now to be this unhealthy, you don't need any of them. And I agree. One of the things is they're taking too many supplements. And I think people it's like their whoopee blanket to some degree. Like, I need this. No, you really don't, because it's not serving you. You've been taking this for 5 years and you still have a deficiency. You still have a problem. You still have the same issues. Yes, but I need it. No, you don't. You think you need it, but you really don't. And probably this is part of the problem. So I think one of the big things I get upset about in functional medicine is the greenwashing of medicine, which is, hey, drugs bad, supplements good. And I probably was part of that problem when I first got in there as well, right? So I'm not saying I'm any better than anybody else, but I think we need to kind of stop that concept or that idea. I don't think that's functional medicine. I think we need to realize that our goal as functional medicine practitioners or anybody in this space is to help get to root cause issues and try and improve them. And you and I are going to talk about this probably in a little bit, like what are the strategies for doing that? And supplements is not the number one. Supplements are exactly what they should be, supplemental to the other things that we're probably I have no doubt, are going to agree upon what people should be doing on a daily basis to improve their health and well-being. And so that's part one. Part two for me is this circle the wagons mentality around diet and nutrition, where we circle the wagons and we're shooting in. We have the ketos arguing with the vegetarians, arguing with the vegans, arguing with the paleo, and everybody's holding up their flag saying, I'm right. This is the best diet for everybody all the time, right? And instead, what people are doing is spending so much energy within our space and community attacking each other, instead of opening their eyes to the fact that, hey, look, the diet that fits you best is kind of vary many times depending on what you're doing, what your lifestyle is what's going on in your lifestyle. And the issue isn't whether you're eating whole organic fruits, vegetables, crops, or animals. It's, are you eating less crappy processed food or more crappy processed Franken food? That's where the argument should be. And I sit back and I wonder, the processed food industry has got to be laughing their balls off, just saying, oh my gosh, I can't get this, all these smart people, and they can't see the forest through the trees. They're not the issue. They're arguing with each other. That's awesome for us. Meanwhile, we'll put out more crap and people will continue to buy it. So that's like my second big thing. And I think the third thing is, and this took me some time to understand, is that it's not all or none allopathic or functional medicine. There's a space for both. If I get in a car accident, I'm bleeding out, please do not drop some herbs on my belly and rub them in, right? That's not what I need. If I'm bleeding out, I want to get a cauterizing knife, stop that bleed, fix my broken limb, right? No essential oils in the moment. That's maybe for another day, another time. There's a place for healthcare, and there's a place for healthcare, which we don't truly have well established. But within what we're doing currently in this thing we call healthcare, there's a place for allopathic medicine to keep you alive, to help with crisis care, to help with acute care, and to do management care for those who want that as their primary treatment. And then there should be a place for functional medicine for those who say, hey, listen, I want to get healthy. How do I do that? How do I address root cause issues? That should be functional medicine space. So from a functional medicine's perspective, we can't say, we have to be willing to say that there's space for them, so that they're willing to say there's space for you and everybody gets acceptance. Does that make sense?
Yeah, it does. And it's funny because there are some people who I think tend to trash on allopathic providers and say there's no one out there doing what we're doing. And I'm like, I'm here. Like, there are some of us, so I think that we all have something to learn from each other. And I mean, this is kind of what the conversation that we started with, is that we all just need to drop our ego and realize that we have stuff to learn from each other. Mm-hmm. I know that that's probably easier said than done, but
It is. It is. I mean, I worked in the hospital for, I don't know, 5 years, 6 years, and the ego, I mean, there were some, I was in the OR for a period of time, and it was one of the best places to work was in the OR once you kind of got used to it. Some of the egos in there, man. But some of the people that were in that environment were some of the most fun, best people that I was ever around. There were some real goons there too, but there's room for everybody. We have to be understanding of that. And we have to also make sure we understand what the patient wants. What does the patient want, right? We know, we can tell them what we think is best for them, but what are they going to do? What are they willing to do? What do they have the mindset and willingness to do right now, right? And that becomes important because the person who has a thyroid problem may come to me and say, hey, I want to fix my thyroid problem. What medication should I use? That's not me. If you're asking me which medication is the best, like just to normalize your TSH, go see your allopathic physician. They got all the drugs. If you want me to help you figure out why your body's adaptively creating a hypothyroid state, now you've got something. Now I can help you with that. But if you're just looking to normalize the TSH, I had this conversation earlier today. Somebody called me and said, I want to come see you so you can tell me which is the right type of medication and the right dose. I'm like, okay, so what caused this to begin with? And they were like, I don't have any health issues. I'm really healthy. I just have a thyroid problem. And that was one of those times when I could almost lose my shit because I'm like, there's no way you just have a thyroid problem, right? But that's all they wanted to know is should I be taking T3? How much? I'm like, look, if you're trying to normalize a lab value, go find somebody who's going to prescribe to a lab level. That is not what I do in functional medicine. And I don't think that's what functional medicine is. I think what it should be is helping you figure out root cause issues, address those so you don't need as much of that medication. And we're not playing this whack-a-mole with lab values, right, to try and hammer them back and forth into range. Instead, we're saying, hey, you're healthier, your dose needs to go down. You're healthier, you don't need that blood pressure medication. You don't have a cholesterol issue anymore because we've actually addressed the root issues, right? So we got to focus on the peeps now, the clients, right? So the people that come to see us, they're listening to this and saying, but how do I help me? Like, this is all good, right? But you know this because I'm sure people ask you questions, they ask me questions, but how do I fix myself? Because typically when I'm doing posts, I'm trying to educate, not give you, here's the 3 things you need to do to fix your thyroid. That's not my shtick when I'm trying to help. I'm about, here's a paper, here's what it says, here's what it means. And getting people to think differently so they can help themselves later. So when this is Thyroid Answers podcast, but I tell people all the time, I don't treat like thyroid, right? What I do is help. I don't care what disorder you have, but thyroid's a nice topic to talk about, to bring people in, to be able to have the next conversation with them. Like, hey, your thyroid physiology is not broken. It's just adapting to whatever the cell stress response is. Let's identify what that is and address it. And then it gives me the opportunity to work on their gut, their hormones, their sleep, their respiration, all those things. So for the person who's listening, they're going to want to know, how do I help myself? How do I fix myself? Where do you see the things that somebody should do or could start doing on their own? No physician, no extra money spent. What are the low-hanging fruit things that people can do, should do to get themselves at a higher state of health?
I love this question. And I think for some things, just like any good provider, it depends on the person. It depends where you are in your stage of change in your mindset and your philosophy. But some basic things that I personally and professionally believe that everybody has the power to make some changes in. Number one is your sleep habits, period, the end. It's a thing I talk about and try to help my patients make changes in before I even, venture really into nutrition or exercise. 7 to 9 hours of quality sleep a night. So that means that you're not generally waking up at night, or maybe you have to pee once. And when you wake up in the morning, you feel really well rested. You're like, okay, I'm ready to attack the day. Some things that people can do to improve their sleep. I love these. Sleep is one of my favorite things to talk about. So I could talk about this endlessly. Sleep in a cold, dark room. the coldness, the temperature varies based on person, but most people will say temperature between 64 and 70 degrees. Reason for that is if your core body temperature does not drop, your body has a much harder time getting into your deeper stages of sleep that are most restful and restoring to you. Quiet room, if I didn't say that already, no TV in your room. Stay off your phone an hour before bed. I realize that that's our means of communication. Some people try to get extreme with that. So maybe that's another issue with functional medicine too, is they're like, get off your phone 4 hours before bed. And I'm like, how about an hour? Like, let's just, and if we're maybe a half an hour, if an hour is too hard for you to start with. So those are the things that I would say for sleep. I also love magnesium for sleep. I like magnesium glycinate. It's more bioavailable to the body. So that's generally my recommendation to patients. Stress management is another thing. So these are my foundations of health, right? So everybody has stress. The patient who tells me they have no stress, I'm seriously worried about their awareness of what's going on in the world around them and their bodies and everything else. So pick 1 or 2 stress mitigation strategies that work for you. There's tons of free meditation videos out there, tons of free meditation apps, YouTube, whatever. There's free yoga videos. Those are 2 really great ways that I personally feel help reduce stress the best. That mind-body connection, that breath work is super helpful. And, try some different things out. But one thing that I would urge people is that I hear a lot of people say, well, oh, the gym is my therapy. The gym is my stress relief. And I'm like, okay, that's cool. But exercise, we all need to recognize, is a stressor on the body. So that's also something that you need to add in recovery and extra time in your parasympathetic, which is your rest and digest state. So if you're out there pounding the pavement for 2 hours, you better be sitting on your couch or low key activity like stretching or whatever brings you down from that. For nutrition, I realize that there's a lot of people out there who want to have the argument about cost, and I'm not going to sit here and have that argument with people, and I'm not even going to get into it. I realize that fresh food is expensive. However, frozen fruit, frozen vegetables, cans, beans, there's always a healthier option. I usually have my patients start with 1 meal a day. So if they're not eating breakfast, I'm like, let's start eating breakfast and let's try to use the plate method. I literally teach that to my patients. I do nothing fancy. I'm the least fancy person anyone could ever hope to meet. And really work within your means with that and into something that is sustainable. And I urge people to not be too restrictive and, not use words like cheat and good and bad with their food, because it can really just cultivate a lot of messiness. But picking one thing with nutrition that you can change. As far as exercise goes, I think one thing that is seriously under walking and the lowest hanging fruit of all time is freaking walking. Like, period, the end. Walking is free. Not everyone can do it, obviously, if you are paralyzed or something. I'm not talking about those people, but if you're able-bodied, you can walk. I actually started telling my boyfriend I'm probably going to start walking to work in the fall just for extra movement in my day. It is 115 degrees here sometimes in the summer, so no one wants to meet with me after I've walked a mile on that. But walking for exercise. If there's something else that brings you joy, do that. But if you're doing nothing, start walking. If you have a dog, your dog wants to be walked. I'm a huge fan of animals. So I use that leverage against my patients a lot. And then relationships. If you don't have any close connected relationships where you live, go get involved in a hobby or something that brings you joy. I've started asking my patients, what brings you joy and how much do you do it? Like, that is so important to how we live our lives. And we, as strong and independent as I am, like, we all need relationships, and you need to go find that somehow. So I urge my patients, whether it's through church or another community or CrossFit or whatever it is that they do, yoga, like, say hello to someone, make a friend. Those are my low-hanging fruits.
I think those are all fantastic things, and they're all things that don't cost anything, and I think they're all really important. And there's lots of these things, and I think that's important to people, that people need to be aware, and that there's things that they can do. Like, assessing your blood chemistry and getting that deep into that is probably, I don't want to tell anybody not to do it, but that's like a deep, dark hole that takes a lot of work and experience to kind of do. And if you don't have that skill set already, instead of bogging your time down doing that, start doing the things that you don't have to have a science education or to learn iron physiology to understand. Do the things like you said, increase your physical fitness, right? And it all depends on where they start. I can only walk 10 minutes a day. Fantastic. Do 10 minutes. Do 10 minutes, right? Or do 3 minutes multiple times per day and increase those 3-minute sessions every week, right? By 30 seconds or a minute. Start physical strength training of some form. I can't go to the gym. I don't have a gym. I can't do that. Look, can you get up off your desk? Yes. Set a timer on your phone. Every 30 minutes, the timer goes off. You do 5 push-ups off your desk. You do 5 squats. You do 5 lunges. You run up the steps. I don't give a crap what you do, but just do something for 5, 10, 15 seconds every 30-minute window. Why? Because the person who says they don't have time, if you ask them, do you have 30 seconds? Yes. Okay, great. Right? You can do it. Do it. Well, I don't have an hour to work out today. You don't need it. You'll get an hour. If you did that every 30 minutes. And I had somebody say, well, what if I'm on the phone call? Who cares? You missed that one. If you're 16 hours at your desk and you make half of them, right? You've got plenty of exercise in. That's 16 sessions of 5 squats or 5 lunges or 5 push-ups or 20 lunges, whatever. You'd be surprised at how much exercise you can get in by the end of the day. I have one of my clients, he's been a long time chiropractic client. He came in the other day and he finally kind of took that to action. He said, I did 150 squats the other day while I was working. And I'm like, awesome. And could he have done them in one shot? No. Right. But he got it. He did all of that in like 30-second or less bursts. Right. So everybody can start, and you can start with whatever you have. There's so many videos to do. Just start doing something more than what you're doing currently. You don't need a fantastic gym. All you need is your body, right? All that other stuff is fluff. Go outside, walk. If you can't run, you walk. If you can't walk, go row, go do a skier. Do something that's increasing your level of fitness and build on it. 30 seconds a week, a minute a week, just build on it. It's so important. And we could have a whole discussion on the importance of sleep or exercise for sleep. When you are burning energy, you're burning your ATP, adenosine triphosphate. That creates the sleep molecule called adenosine. That's the thing that helps you stay asleep at night. Adenosine is critical to sleep and rest and recovery. That's your molecule that's telling your brain, yo, we expended so much energy. We got to shut this whole system down and build it back up again. Everybody gets so focused on melatonin. And I'm like, look, when's the time you had the best night's sleep? It was the day that somebody made you go outside and do a day's worth of yard work that you haven't done in 6 years. And now you come home, you pass out at 9 o'clock and you wake up 8 o'clock the next morning, fully refreshed. You're like, I had a great night's sleep. Right. Why did that happen? You generated this sleep molecule adenosine. Yes. And then looking at our habits, our behaviors, right? There's things that we do on a daily basis that is the things we do, I should say it this way, the things we do on a daily basis are either helping us improve our health and quality of life, or they're taking away from our quality of life. Mm-hmm. You want to know why you don't have time? Make sure that little thing is set on your phone that tells you at the end of the week how much time, or at the end of the day, sometimes, how much time you spent on this thing. And really, now, this doesn't hold true for your posts or my posts, but how much other time do you spend on Instagram and Facebook and really walk away and say, man, that was rewarding? Different if you're listening to our posts, right? Or our videos, that's right. Different. But most times, do you really walk away and go, man, I feel so much better that I spent 6 hours on Instagram this week? No, not really, right? So I'm probably see my subscribers drop off. Like, that's probably not a good thing, but it's honest, right? The issue is we spend too much time on it. Somebody asked me, how come you don't like any of my posts? And I'm like, because I don't spend that much time on it. I post to give content, but I'm not spending a lot of time on it. And none of those people that are dancing around doing TikTok videos with their Porsche and their boat are really people who probably have a Porsche and a boat.
No, anyway. They probably rented it.
Right. And then the other things we have to do is look at what are those things that you're doing, and what can you fix out of those things, right? I have this kind of review, prune, and replace. So review what's going on, right? Like, what do I do every day? Review what your habits are, prune those things out little at a time that are creating problems that you know aren't good for you, and then replace them with something. That's really, really important. And then I think it's very beneficial to all of us to do this is, I think, a military term, which is an after action report. Like, yes, at the end of the day, decompress and say, okay, what did I want to get accomplished today? And what did I accomplish today? And reward yourself for the things that you did accomplish and get done, and pat yourself on the back for those things. And then take those things that didn't get done and say, is it really that important? Or if it is, I got to get that on my top of the list to do tomorrow. But end the day being grateful, right? And feeling like I achieved something as successful. And that's a huge way to reduce your stress. So I think a lot of those things you talked about become really important. But how do people do it? It's not hard. It's just taking little steps at a time to bring up your level of fitness, whether it's physical fitness, dietary fitness, your sleep fitness, your respiratory fitness. And I think you and I would both agree that sometimes making some of these changes they're simple, but not easy, right? They're uncomfortable. Yes. Right. Yes. And people, a lot of times we don't want to be uncomfortable, right? Do you see that in your practice as well?
Oh God, every day. Sometimes I walk out and I'm like, oh God, that was hard. Like, it's exhausting sometimes, because I talk about a lot of the same things, because we all, the story is unique, but the struggle is universal, right? Like we all, most people need to improve the same things. And so sometimes during the day, I feel like I'm just on a repeat reel, of drink more water, eat your vegetables, get more sleep. Like, I honestly feel like that's 50% of the job that I do, because I don't think we said this earlier, but I work in family medicine. So I work in that preventative care aspect and trying to keep people healthy, et cetera. So that's a lot of what I do. But yeah, it's very difficult. I mean, there's a dietitian on Instagram who I really like, the Sassy Dietitian, and her and I say the same thing all the time. Nutrition is simple. It's not easy, because your brain gets in the way. And then there's other things like trauma and mental health. And how did you grow up around food? And were you yelled at to clean your plate? Or did you grow up poor? I mean, there's so much behind all of our behaviors. And that's why I feel, and I should have mentioned this earlier, but emotional intelligence and mental health are two of the things that I would add to that list of like things to deal with and improve, right? Like, if you can afford it, see a therapist. I don't care if there's nothing wrong with you, that nothing needs to be wrong with you for you to see a therapist. And I think that's one of the most common misconceptions. But if you're working on some of these changes too, I talk to my patients and I say, you're making a big change. Like, you have been this way and you've made these decisions, and these habits have been ingrained with you for 20, 30, 40, 50 years, whether it's smoking, your eating habits, your sleeping habits. Have you thought about seeing a therapist while we work on this? And people laugh at me. And I'm like, no, I'm actually serious. Like, and I explain to them why. And then they're like, I'll think about that. And I'm like, okay. And I get a lot of people into therapy, and I'm quite proud of the number of people who I get to address their mental health.
I think it's important because it's interesting. I had this conversation with a client this week who said, we were talking about he's got a stop that's preventing him, right? Everything's an excuse. Everything's like, I know what I need to do. I just have to get it done. And I'm like, okay, but why aren't you doing it? Right. And he's like, and then we started getting in. He goes, well, I don't like talking about this stuff. I'm like, well, that's why you need to talk about it, because those are the things that are the breaks. And he said, well, it's probably easy for you because, you didn't have any problems in your life. You didn't have any problems in your childhood. I'm like, listen, if you want to know my story, I'll give you my story, but it doesn't look beautiful what's behind the curtain, right? And there's part of the issues I had with some of my health challenges are probably the result of my mother, mother, father, teacher, preacher, right? All those things that happen, those limiting beliefs, people telling you you're never going to amount to anything, right? All these abusive and traumatic, how the dynamics. I'm just blessed. I have two fantastic siblings that we came through the kind of the chaos together, and instead of it making us more disruptive, it brought us closer together. And so we have our sounding board that we can kind of work our way through that process. But we all have those struggles, right? I think you already said, like, the individual stories are a little bit different, but it's really all within the same context, right? Everybody's got trauma. Everybody's got these things. Everybody thinks theirs is the worst. And some people's stories are brutal. Ooh. But every time I hear somebody say, my life is terrible, I'm like, yeah. And there's somebody else and a lot of other people that their story is worse than yours. So pick yourself up. We got to move forward, right? If you live in that world, you're never going to get healthy with a mindset that's keeping you trapped, right? And so that is so important for people, the emotional and mental aspect. It's not my strong suit. I've been through it on my own. I've come out of that on the other side, but I think it's a critical point or thing that has to be addressed. And I think people need to learn that just because something happened to you doesn't mean that you need to stay there. We talk about fight or flight, and where most of our chronically sick people are in freeze mode. Yes. They're in that middle road. I'm sure you see it in your practice and talk about it. Do you want to discuss that maybe a little bit?
Yeah. So I love this topic, and I feel like the patient that I flourish with most is the patient who has trauma and it's affecting their health, because I don't think there's a lot of medical providers out there having that conversation that your mental health is affecting your physical health. And I don't mean that in a way that it's all in your head. And I say that outright to my patients. But my mental health background really helps me flourish with these people and getting them the help that they need and the help that they deserve to move. I don't like to say move past things, because I don't know that I've had this conversation with my therapist. I don't know that we ever really get over things. But there's a point when we know we've mostly successfully moved through them. And I think that is the important point that we all need to get to as human beings with the difficult things that we go through. And I don't mean that as a past term, because there are going to be more difficult things that I go through and you go through and everyone listening will go through in their life. Right. So really breaching that conversation with people. And I think some resources that are relatively cheap for people that they can go look at. You're talking about mindset. A book called Mindset by Carol Dweck is amazing. It teaches people the difference between a fixed and a growth mindset. And I think if we had more people living in a growth mindset, we would have more people attacking these types of things and taking more responsibility and kind of just the entire conversation that we've had. The Body Keeps the Score by Bessel van der Kolk is, to me, the Bible on trauma. If you've been through a traumatic event, which if you're a human and you've made it to your 30s, you've probably incurred one. And if it's negatively impacting your life still, that book is amazing for that. I have several friends who are reading it right now. And the book When the Body Says No by Dr. Gabor Mate, he talks about various types of diseases and how he's seen certain personality types and mental health struggles in each of the people who have developed these types of diseases, and how if it's basically like that with which you do not deal will deal with you. It will come out eventually. And I really try to stress that to my patients. And if you don't deal with this mental health struggle, if you don't deal with this trauma, like, you're going to start having physical ailments if you haven't already. And I can spot it a mile away. The person who has trauma, I literally by the symptom constellation can spot it 10 miles away. It's not even a challenge for me anymore. And my medical assistants, I'm like, you guys want to bet on this? And they're like, nope, not anymore.
And the issue is you might be able to see it, but that person doesn't realize that the issue or the thing that's holding them back is a trauma, right? That's happened to them in the past. And they encapsulate it and they think they pushed it. They don't even know maybe, but it's deep. They think it's buried, right? And the only issue, the issue with burying things, it's like seeds, right? You push those seeds deeper into the soil, and sometimes you forget that they're there, and then these things pop up, and you think it's something totally different. And we see that with healthcare all the time. Hey, I've had this traumatic experience. I had this issue happen. I buried it. It's not an issue anymore. Not dealing with it. And then all of a sudden I have gut issues, or I have I have anxiety, or I have disrupted sleep, or I have some other issue. And it's because it's not the seed that you buried, you think it's a different thing. And in reality, the plant that you see is what came from that seed, right? And so that's the big issue, is what causes stress is not always what we see as the outcome, and it doesn't always look like what we buried. You know what I mean?
Yes. 100%. And I think something that you touched on is something that I've heard a couple of my patients say, well, it just came on all of a sudden. And I'm like, it didn't just come on all of a sudden. We've ignored cues. We didn't understand or be in a safe place in our bodies and in our health and in our mindset that we were able to pay attention to those things. Panic attacks is one where I have patients all the time. Well, it just started coming on out of nowhere. That didn't just start coming on out of nowhere. You were just in a space where you didn't pay attention to those physical symptoms that were warning signs. So paying attention to things that are happening in your body and what do you feel and what type of symptoms are you having? Like, do you maybe start to have more restless sleep? Are your periods getting messed up? I had to bring periods in here, of course. Are you snapping at people more easily? Are you maybe missing a bowel movement once a week? Like, those things can be warning signs that things are going wrong. Don't ignore them.
Yeah. And I think that's I think that's a really important thing to kind of point out is, our body's often giving us signals that say, hey, there's a problem. And unfortunately, if you've grown up watching TV, you've been indoctrinated by commercials as to, hey, some of these disorders are normal things, like they're external things that happen to us. Like, you just have a migraine syndrome. The solution is this drug, right? Or, right. Hey, everybody gets reflux, right? That's why there's this medication, right? Or asthma, just 2 puffs, right? And so we grow up watching this and getting it kind of ingrained into our psyche. And we just, after a period of time, we just assume that that's stuff that just happens to us, or it's genetics, yes. Right? And it's not. And this is a problem with our functional medicine society too, is some of the people have gone so far that everything is the result of a genetic polymorphism instead of, no, it's the epigenetic regulation of whether a normal gene or a wild form or a polymorphism. It's not that thing. It's the epigenetic regulation. I think I got into this with somebody who said, but I'm a non-converter of T4 to T3. And I'm like, what does that even mean? Well, my doctor told me I'm a non-converter. I don't convert T4 to T3. I'm like, based on what? Like, if you were a non-converter of T4 to T3, you would have neurodevelopmental challenges if you even made it this far, right? Right. When did it all start? In my 20s. Okay, then you had to have been a converter. How? Oh, it's a gene thing I can't convert. No, that is not it. So those are the things which is a tangent. Those are the things that kind of irritate me. But those are the things. We have people who are looking at what's happening to them as an external thing, and everybody gets headaches. Everybody has GI issues. It's just irritable bowel. Everybody has irritable bowel, right? It's a disorder. I have depression, as if that is the thing, or anxiety is the thing that we need to treat, instead of saying, hey, depression, anxiety, those are signs and signals that there's something wrong in the body, something wrong. That's the body kind of screaming out, saying, hey, there's an issue or there's a problem, right?
Oh, I agree 100% with you. For people who can't see me, I'm like literally aggressively over here shaking my head, because I have patients who come into me and they're like, well, I'm just on the regular medications. And I'm like, that's not a thing. Like regular medications. Right. And what they mean by that is hypertension, hyperlipidemia, and diabetes. Like, people just think by the time that they're 50 that this is just something that happens to them. No, this is not something that happens to you. This is something that you have spent a lifetime ignoring your body and ignoring your health. And that's why this problem is happening. This is not normal to have to require medications. I literally put a post out about this, and I was like, this is not normal. This is medicated survival. And right. I'm not here to shame anybody for that. I'm here to encourage people to make different decisions than your parents. Even with anxiety and depression, I'm like, this is not maybe this is not something that's, a neurochemical imbalance, but maybe you spent a lifetime growing up with parents who were an anxiety riddled mess. Maybe they didn't understand how to deal with stress. Maybe they didn't build up that mental health muscle. Maybe they quit every time something got hard. So now you quit every time something got hard because it was normalized in your family. All of these things, there are exceptions, right? Like Huntington's disease, like you can't fight that. Sorry.
Right.
If you get that gene, you're kind of screwed.
Right.
And there are, yes, genetics do play a role, but we give our genetics so much freaking credit, and you need to start giving yourself more credit for the things that you can do and that you can change.
Right. Somebody said to me, my problem is the genes. I said, it's the genes you're wearing. It's not the genes that are in you. It's not those, because it's more a factor of what's happening to the genes. The issue is, and for the people who are listening, we are on your side, right? We are not saying that it's like your fault. What, you bad person? The issue is how we've raised people is that they're a victim of the environment versus that they are an active participant of their environment, right? Where you do have control. You just aren't aware. And we're not teaching people that high blood pressure, that's not normal. That is the result of these factors. And these are all things that are fixable. And also being aware that some people just don't want to hear that message when they need to hear it, or not willing to. The reality is, when you're 20, you don't want to hear much of this at all, typically, right? When you really maybe start to get a little bit more concerned is when you're in your 40s and 50s and some of those things are catching up to you. And by the time you're in your 70s or 80s, you're like, what the hell? I'm on my way out anyway. I'm going to do whatever I want to do. But I think if we do a better job early on with our kids and our children and teaching them true health care versus sick care management. Hey, Johnny's got asthma. Yeah, he does. Why don't we start working on why Johnny has asthma so that then he doesn't have to keep taking that puffer and do that thing every day? But it's a different mentality. No, all the kids have puffers, right? That's just what it is. That's just normal. All kids have allergies today. Are you kidding me? We start to look at not having a condition as the abnormality versus being not having the abnormality is the thing, right?
Yes. I'm a freak to people. Like literally, I'm a freak to people because I work out regularly. I bring my lunch to work and I focus on my sleep and I don't take any medications. Like people literally look at me like I'm some type of person with 6 eyes. And I'm like, that's not okay.
And they'll probably say, but it's easy for you.
Yeah. And I say bullshit to that.
Right. And so, because everybody assumes it's easy because you're already there, right? We see the Hollywood movie star, The Rock, and say, well, it's easy for him because he's a movie star. But how much hard work and labor went into doing that? How much work does it take for you to maintain a higher state of health? It is easy to be sick, really easy to be sick and unhealthy in this world. It is hard to maintain a level of health and fitness in this world with all the things you're up against. So we totally understand it. But the issue is, it is a constant level of work, because if you're not working on it, trying to improve it, you're regressing. I love people when how's your health condition doing? They say it's not changing. Bull. You're either working on it and it's getting better, or you're not working on it and it's getting worse. It really does not stay status quo. Nothing does. So it's always, you're either working towards improving or maintaining. It takes more work to maintain, takes even more work to improve. It takes little to any work to just regress.
Yeah. And I think something that I thought of while you were talking about that is, yes, you're correct in everything that you're saying, but it's choose your hard, right? I had a yoga instructor who I love their class, and they usually talk every Sunday morning before we start class. And she talked about choosing your hard. And one of the things she talked about was it's difficult to be lazy and unhealthy, and it's difficult to work hard and be healthy. It just depends on when it's going to catch up with you. Because as someone who is not doing the work, you sit back and you want for those other things. But for someone like me, it's what people don't see is me getting up at 5:15 every morning, me rushing around and doing all the things and making good choices at the grocery store. But I built that muscle. It wasn't easy for me when I first did it. Trust me, I grew up eating like Three Musketeers jelly sandwiches and like donuts in my lunch. Like I was not I was the worst eater as a child. So what you're seeing now was not cultivated from a kindergartner. I was always active. So I'm fortunate in that aspect that that was always valued in my home. So that aspect for me, I have a very hard time trying to teach people to like exercise because I don't know. It's just what I do. But I think people need to think about that. Like if you're not paying attention to your health now, it is going to catch up with you. You're going to hit that donut hole when you need insulin and when you're on Medicare, and you're going to have to pay for that and pay for the hospitalizations and suffer those consequences and the sarcopenia and the osteoporosis and all of these things. So I tell that to people not to freak them out and scare them, but to show them that you're going to have the hard things are going to come one way or the other. So you need to make that choice, and you need to start making it in your 20s or 30s instead of your 60s and 70s.
Yeah, I think, and I don't know where this came from, but you know, the harder you work on your health, the easier life actually is going to be, right? And the less work you put into your health, the harder your life is going to be. And I think we see that the more effort you put into that grind every day, the more enjoyable life is. The people who are just kind of sit around, they don't do much, they don't have much activity in their life, they don't eat good, they don't put much effort into it, they have pretty difficult lives usually. The people that put a lot of effort into it really get the most enjoyment of their life. It's work, it's constant work, right? It doesn't come easy. And I think that's the really important thing for people to understand, that if you're regardless of where you are right now, to get to a higher state of health, you are going to have to put all kinds of work in to get there. But the payoff at the end is so rewarding. It's easy. When you say, listen, I want to go hike the John Muir Trail, you go, I can do that, right? The average person in the US today, if you said, hey, I want you to be on the John Muir Trail for a week on your own, solo backpacking, they'd be like, there's no freaking way. That's not possible, right? But when you don't do difficult things, a lot of things seem impossible. The more difficult things you do, the more possible and probable things are going to be, right? And you see more options. So I think if we've done anything today in an hour and a half, I said maybe we go about an hour and a half. We could keep conversation going, but we both have things to do. So maybe we'll do this again in a couple months. We'll continue our conversation. But I guess if you had to give the listeners like a parting thought or two, most of the people listening are people that are struggling with chronic thyroid issues. We have a lot of practitioners that listen in. We got people from all over the world that listen in. I'm often surprised at, where people come from, but like what one or two parting messages would you give somebody as we end this podcast?
Oh. I would say the first one is that you have the power to choose and live the life you've imagined. If you feel held back by something, start making one different choice today. Start right now. If you're someone who struggles with sleep and you need to get to bed earlier, start going to bed earlier. Choose one thing to move towards whatever you feel is the thing that you want. And we're all different with the things that we want, right? Like some people may never want to hike the John Muir Trail and think that I'm a lunatic for that. And that's okay. But maybe you just want to be able to run a 5K, or hell, maybe you want to be able to walk a 5K, go out and walk 5 minutes, make one change and start right now. Don't wait till tomorrow.
Yeah. I think that's really, really well said. And I think a great place to end this podcast. So if somebody wants to know more about Danielle, where are they going to find you?
Yeah. So with social media, I hang out mostly on Instagram. My handle is at Danielle.Kepics. My last name is spelled K-E as in Edward, P as in Paul, I-C-S as in Sam. If you want to listen to more of my banter, I have a podcast. It's called Strong and Unfiltered. I'm sure after this 90 minutes, that's a really shocking title. And the tagline to that podcast is live the life you've imagined. So
awesome.
Yeah, thanks. This was awesome. I could definitely go forever.
Well, for all the listeners, you might have to listen through this once or twice. Make sure you share it with friends and family. If you're getting good information from this, you want to hear more, go to wherever you listen to your podcast and give us a rating. If you think it's good, I think 5 is the best that you can give somebody. So probably deserving. But anyway, Danielle, thanks so much for coming on the podcast. And I look forward to maybe having you on again. All right.
Awesome. Thank you.
Take care. Have a great day.